March is Brain Injury Awareness Month. Joining us this morning to tell us about both sides of this type of injury, Dr. Rani Lindberg, a UAMS physician who practices at Baptist Health Rehabilitation Institute, and Jim and Patty Drake, whose daughter suffered a traumatic brain injury, are here for us this morning. Very important discussion coming up.
Yeah, TBIs can be very serious things, so it's really good that we're getting that information.
Yeah.
From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
Welcome back to Good Morning Arkansas. March is Brain Injury Awareness Month, and joining us this morning to tell us about both sides of this type of injury is Dr. Rani Lindberg, a UAMS physician who practices at the Baptist Health Rehabilitation Institute, as well as Jim and Patty Drake, whose daughter actually suffered a traumatic brain injury. Thank you three so much for being here to talk about such an important topic.
Oh, you're so welcome.
But Dr. Lindberg, let's first go over what a traumatic brain injury is.
And so a traumatic brain injury is just what it says. It's any kind of trauma to the brain. And that can be a concussive force, as little as, football players is probably the most common thing that people think of when they think of concussion. So that can do it, a blast injury. And so our folks in the military, veterans coming back from active duty, blast injuries can cause that. Falls, where things hit somebody's head, gunshot wounds, any kind of trauma, anything that puts some kind of force to the head, however minor. Some folks may exhibit symptoms as subtle as just seeing stars for a second, or it could be as major as loss of consciousness for minutes, hours, weeks, months.
Wow.
Yeah.
And so what are some of the side effects that come along with the recovery process when it comes to a TBI?
So the recovery process is really variable. Everybody's brains are different. That's what makes us all different people, different personalities. So the recovery process is super different for everybody, and you guys know, who go through brain injury recovery. And it depends on the area of the brain that gets affected. And so it could be as simple as a little bit of rest, relaxation, let that brain calm down to recover, or it could be a prolonged rehab process focusing on behavioral or cognitive issues that got affected if that area of the brain was affected by the injury. Motor recovery if you end up having weakness to one, two, or all four limbs. So it really is super variable. It could take days and hours for some, or it could take months and years for others.
Wow, that's incredible.
Yeah.
So let's move over to the Drakes now. Tell us your daughter's story.
So Mary was coming home from her grandparents' house in 2009 and had a car accident. She and her boyfriend were in the car. Her boyfriend was fine, but Mary was not. She was airlifted to Children's Hospital. Spent 8 months in the hospital, 5 months at Children's, and then 3 months at Baptist Rehab. And our whole goal was to take Mary home with us. And so once we were getting to the point where we were going to be discharged, that was our whole focus. We wanted to take Mary home. And so Mary, just like Dr. Lindberg said, is on that end of the spectrum where you didn't get that, TV outcome where, the patient wakes up and everything's great. Mary is awake and she smiles and she's happy, but she's unable to speak or unable to take food by mouth. She's wheelchair bound, so she's total care. So I'm her caregiver. But it was very important for us just to be able to keep her home with us. So we're now 10 years out and have been living that life for 10 years now.
And
so,
you say it's not the perfect TV ending, but that's a real story. So that's what's important for people at home watching this to know. There is a positive outcome that can come from something that's so traumatic and hard for your family. What's it been like for you seeing your daughter kind of go through this process?
It's been hard, but it's also been a period that we have come to understand joy. And having her home is one thing, but I think we have a unique story in the sense that we have just been enveloped by God's love through the people in this community and our church, and it's made us appreciative of all the gifts that He's given us, and especially Mary, because if there's anything that we can bring out of this, it's that so many people who we don't even know have told us that they have found Christ because of her.
Wow.
They look at her and say, whatever I'm facing, I can handle it because I can see how she does it.
That
And
must feel amazing for you guys.
It is.
And how has the process been working with Baptist Health?
Well, we fell in love with Baptist Health the minute we got there. Several of the therapists, and one in particular that still, we see her 3 times a week. She comes to the house and just, she's actually become part of our family. So they treated us like family, and we just never, it was hard to leave. Number one, taking home someone and you don't have a call button.
Yeah.
That's one hard thing, but we left our family. So yeah, it was a great experience for us.
And so, Dr. Lindberg, when you see families that, feel this connection with Baptist Health, how does it make you feel as a doctor?
It's amazing, and it's one of the reasons I went into the rehabilitation field. This is the one time in medicine where you truly get to practice the art, where you develop relationships and programming and care plans specifically for an individual rather than treat by protocol. And you get to be part of a really important time during these families' lives where they're learning such important things about themselves and their relationships with each other, and watching them develop relationships with other folks who are so important in their lives now, because their lives are different, they're changed, they're at a new normal, and we get to help them learn to cope and survive through that.
Yeah.
And it's pretty awesome to be able to experience that.
Well, thank you 3 so much for being here with us and sharing your story. We really appreciate it, and it's a really important topic to talk about. And thank you, Doctor, as well. If you would like more information, you can call Baptist Health at 1-888-BAPTIST. We'll put that up on your screen for you. And once again, thank you 3 so much.